After months of planning, the U.S. government's warp speed rollout of COVID-19 vaccines has progressed at a snail's pace once the allotments were turned over to the states. A CBS report on which states have done best and worst has some shocking findings. According to the report, West Virginia has done the best job in getting 70% of its vaccines to its public, and Georgia the worst at only 20%. Our state, the state of Maryland, is stuck decidedly in the middle of the pack at 32%. But even those numbers don't tell the whole story, as there are endless tales from people, myself included, who have spent hours and days trying to get an appointment for the vaccine to no avail. Ron, the headline of the Baltimore Sun reads, "Getting an appointment for the COVID-19 vaccine in Maryland is the 2021 equivalent of striking gold." Why is it so hard?
Well, I think it's like everything else in this country. Access to resources go to those who have access to information first. I think by and large, when Maryland instituted its program to allow people to sign up and register, there was little information dispersed among communities. The Black and Brown community, I doubt, had as much information as available to prepare themselves for access and ways to obtain vaccinations if they chose to accept them. And I think the proliferation of people moving from county to county to usurp resources dedicated to those particular places has also hampered the ability for people to get the things that they need in terms of first identifying availability and then being able to sign up. And the two communities that we're worried about the most, the older community, don't look to technology to get medical resources. And the Black and Brown and underserved populations don't always have time to sit down and spend hours just trying to get a registration done for a vaccine.
Well, look, I can agree with you, especially about the amount of time. I mean, I'm in the 1C category. I'm over 65. And I can tell you, I've spent days trying to time the right moment to log on to a website to see if there's a vaccine. My partner, who sits right next door to me, got a magic phone number for Six Flags. He called, I called 10 minutes later, everything was gone. So it's a frustrating system. And I think it goes beyond just communication. Now, you've done a terrible job, but I want to go to Mark here, because Montgomery County, as Ron has mentioned, Montgomery County has seen the worst of it because Montgomery County residents find it easier to go to Six Flags in Prince George's County than wrestle with the inadequate system here. So what did Montgomery County in particular do wrong?
Well, let me go back and do the comparison between the states, because I think that was a useful number. It seems to be that those jurisdictions that were the most prescriptive, in other words, they set aside vaccines for a targeted group, and then sometimes the targeted group didn't get it, they seem to have the slowest rollout. And again, there's a limitation. There are only so many vaccines. That's probably the big barrier there. So that's one particular challenge. And you can look where Jerry is right now. New Mexico, by some standards, had one of the best systems. The other piece is the transparency with which information is shared within the various categories. That priorities have been set. You're a 1C, but within that, there's some of the questions that you fill out. There's sort of prioritization that's going on in Maryland. So it's not entirely as random as suggested of just sort of hitting the lottery and being able to get a phone call to go in.
Well, I think it's really very, very disappointing that the way the system has worked. I think there has been a general lack of communication. I will tell you, the email blasts that go out from the county executive and the health department, they're so confusing and lengthy in times that you don't even get to the point where you see that there's a link to sign up on.
And I will say that looking at, for example, in New Mexico, which by some rankings was doing much better, had a much more transparent system where they explained these various subcategories in which this prioritization was going on of how to distribute what are continued to be a very scarce resource. We expect more in the future, but right now there are only a few vaccines to be able to go around.
Yeah, Ron, I don't know if this is a fair question to you, but West Virginia had a 70% success rate in getting their vaccine out to the public. What was different that they did than what we're doing, where we're only getting out less than half of that?
Well, I think that there are a lot of things that factor in. Some states have opted to follow the national rollout plan that was proposed, and other places have decided to introduce their own system. I think both systems have opportunity to be successful, but I think what West Virginia may have done that other states aren't doing is meeting people where they are, getting out into the communities where people don't have as much access. DC is walking door to door in some places. Maryland needs to figure this out, whether it's Montgomery County, Prince George's, Garrett, Washington, Allegheny. Everybody has different needs, and the state has to figure out a way to meet people where they are in order to be successful with this program.
Well, I got to tell you, Mark, we only have 30 seconds left, but I'm tired of the state blaming the fact that they don't have enough vials of the vaccine when they're so inefficient in getting that out. It's one thing if they had exhausted the number of vaccines that are available, but they're only pushing out a third. Wrap it up for us.
Well, again, you look at some numbers and they are getting it out. I mean, it's, I understand that the CBS thing, I've seen other metrics that show a much higher success rate. And, some of the mass facilities have the ability to get out literally thousands per day. And that's obviously an advantage to be able to get things out more expeditiously.
Thanks, Mark. All right, we're going to go on to our next topic, because the lack of the vaccine or the failure of the vaccination program goes hand in glove with this next topic.